I'm Jamie Robertson, the Assistant Director of Simulation-Based Learning at the Stratus Center for Medical Education here at Brigham and Women's Hospital, and today I'm going to be talking a little bit about some simple ways that you can incorporate simulation into your teaching. By the end of today's session, hopefully you'll be able to list 2 theoretical rationales for the use of simulation in medical education, provide some examples of low-fidelity models that are used in programs currently running at Stratus, and identify some applications of simulation that might meet the needs of the learners in your own department. So first, a little bit of information about Brigham and Women's Simulation Center. So Stratus is a fully interprofessional and interdisciplinary center. We serve all of the departments and divisions of Brigham and Women's Hospital, as well as some of Harvard Medical School's programs. We have a number of programs that incorporate MDs, PAs, nurses, and a variety of other healthcare professionals. We use a wide range of types of simulation, including full mannequin simulation, like what's in the picture, as well as some part task trainers, some virtual reality, and computer-based simulations as well. It's a free service to anyone at the Brigham, so if you and your learners are based at the Brigham, you can come down to Stratus and run a program, and that is already a service that is paid for by your department. We'll help you out with curriculum development. We run faculty development programs if you're interested in learning more about how to teach with simulation, and we support all of the technology that we have at the center. So you're not expected to be able to run the mannequins or any of the other simulation technology that we have at the center. So one of the reasons why simulation is so useful in education is because that it really puts people in the activation part of this model. So at the top, you can see that people are in a state where they are okay in terms of being happy, but they're also incredibly activated. Much like people are when they're actually in the clinical setting, they're practicing, they're alert, they're a little bit tense that something could go wrong, that something might happen, and that's where people are paying the most attention and can really get the most from their learning. And simulation replicates this same feeling by putting people in a situation where they don't know what's going to happen, and they are learning from the experience as they're going through it. If you think about lectures that you go to, you're often more on the opposite end, where you're deactivated, maybe you're a little fatigued, you might be falling asleep during the lecture, and you may not actually get that much out of the experience. We also have something that we like to call the competence gap. So when a student walks into a learning session, they have their perceived confidence in the topic that they are going to be tested on or be engaging in some activity for. Then they have their actual competence, how much they actually know. And until they go through some sort of testing or activity, they don't really know what the difference between these two might be. So we put them through a simulation activity, and at the end of that, they understand what they know and what they don't know about the topic, and they become a teachable student. So that person is now ready to receive some feedback, ask questions about how they can get better, and really engage in the learning process. So to sort of switch gears over to some ways that you can start using simulation pretty easily in your program, one of the things that we actually use a lot are products that you can buy at your grocery store. So we walk down the street and buy a lot of things that we use for simulation. So we use chicken breast as well as pork ribs, cow tongue, and other things that you can buy from a butcher for a number of programs, including a breast ultrasound and biopsy course. And our chicken breasts are actually stuffed with water balloons and pimento olives to allow people to practice fine needle aspiration and core biopsies. We use papayas in a number of our OBGYN programs for uterine aspiration. Bananas are a really common fruit that people use for practicing suture, and we also use a lot of kiwis and tomatoes for punch biopsies. And there are really an infinite number of options of what you can do with a lot of food products that are easily purchasable. So if you go to the literature and you look up easy simulation in whatever discipline you're looking for, there is most likely something that you can do using something that's readily available at a grocery store. Our recently graduated simulation fellow, Dr. Andrew Eyre, who's in the emergency department here at the Brigham, created this amazing just-in-time simulation cart. This cart lives in the emergency department, And each of the drawers that you can see is stuffed with simulation equipment for a variety of different procedures that are both common and uncommon in the emergency department. These allow people to go to the carts, practice anytime they want, with or without a mentor guiding them through, so that they can get a little bit of practice if they just want to brush up on their skills before they actually do the procedure on the patient. And this has been really successful and useful for both the faculty, the residents, and the medical students that are in the department. When people think about simulation, they often are thinking about the full body mannequins running through clinical scenarios that have a bunch of people in the room and that you can do a whole bunch of different procedures to the mannequin. And those are really great uses of simulation, but we also have a number of these part task trainers that allow people to train a single or a few different skills pretty easily with sort of limited setup. And so one of the things that we'd use the most are the arms that you see at the top of the slide for IV training or arterial line training. And these arms are easy for us to set up several across the table, have a group of medical students or other healthcare students sit down and take the time to actually practice going through the procedure long before they're ever going to get to do it on an actual person. And we have a long list of part task trainers that are available at our center that you can contact us, and we're happy to send you a catalog of what we have available. You can see some of the ones on the screen allow for you to practice lumbar puncture, chest tubes, renal biopsy, and we have a whole host of these that are largely ultrasoundable and very useful for learners at all different levels. One of the things that people often don't think about using simulation for, but that we do a lot, is communication practice, as well as other teamwork and leadership skills that are essential for practicing medicine. So we have a program run out of the medicine department where the residents come down and practice with a standardized patient, talking to a patient about palliative care and transitioning to hospice. These are really important communication skills that often people only get by practicing on real patients on the job. But simulation offers an opportunity where people are able to sit down, practice those skills with a standardized patient, and then receive feedback from both the standardized patient and their instructor about how they could go about doing it better. And this can be used for getting informed consent, looking at different types of transitions in care that physicians need to talk with patients about, or delivering bad news. So this is something to really consider that might be useful for your learners as well. And finally, we do a lot of interprofessional team training. Physicians, nurses, and PAs practice together in the hospital setting, as well as practicing with a number of other healthcare professionals. Since they're practicing together in the clinical environment, they should really be practicing together in the simulation environment as well. We allow those teams to come down, go through a scenario where everybody is performing the job function that they would actually be performing in the hospital, and then take the time afterwards to talk to one another about how the scenario went. We hear over and over again from our participants that that's really the most important part, that they never knew that the other profession had those types of skills or didn't have those types of skills until they had the opportunity to sit down after a simulation. It's a unique opportunity that most people don't get in the clinical environment, because there's rarely time for everyone that was in the room to sit down and talk about a case after something happened. Simulation really allows them to take that time and put everything together and have a nice discussion with one another that will hopefully give them better communication skills, better teamwork skills that they can take back into the patient setting to help save lives. So if you're interested in putting together a simulation program but aren't really sure where to start, there are a lot of resources out there available for you. MedEd Portal has a huge number of peer-reviewed educational experiences that are taught in a number of different settings with different instructional methods. If you go there and you browse their instructional methods, you can actually click on simulation and pull up a variety of different simulation programs. using part test trainers, using full mannequins that are pretty much ready to go. It's a great way to look at stuff that already has data from people who've used it before and know that the content in it has already been peer reviewed. If you go to your discipline society website, they most likely have some sort of simulation curricula available. The obstetrics and gynecologist group has a number of different simulation curriculum available to anyone who's a member, as does the American College of Surgeons. You can also go to PubMed and look for people who have published their simulation exercises in peer-reviewed journals. Simulation training is a mesh term that you can use to pull up the information on simulation-based training programs. You can also type it in as a keyword along with whatever skill you're trying to teach or discipline you're in and get back a number of results. They may not walk you through all of the steps of it like a resource that you'd find in MedEd Portal, but it should give you a good starting point for developing your own program. And of course, Stratus is always there for you as well. I sit down and mentor people on developing their curriculum all the time. We have a number of other people in our center who are available to help you build models, who are available to help you think through things, and to give you their experience based on what they've done with other groups. So hopefully we've given you a lot to think about in putting together a simulation program for your learners. Simulation is a really engaging way for people to practice a variety of both technical and non-technical skills in a safe learning environment where they're not risking patient safety. There are a lot of ways that you can go about doing that and a variety of tools available for you, so you don't have to reinvent the wheel every time you want to do something. We have a lot of great ideas. I bet you already have a lot of great ideas, and there are a lot of great ideas already out there in the literature. And if you're interested in learning more, we always welcome people to come down, check out the center, see some of the equipment that we have to offer. We're located on the first floor of the Neville House, and we look forward to seeing you soon.